Good morning, San Diego. Thank you for tuning in to DanX Radio. Today's topic is nephritis. Nephritis is inflammation of the kidneys because of an infection, an abnormal immune system response, or even disorder of metabolism. This may be acute or chronic, and severe prolonged inflammation can damage kidneys. There are different types of nephritis, including glomerular nephritis, pyelonephritis, interstitial nephritis, lupus nephritis, and hereditary nephritis. Common symptoms are pain in the pelvis, lower back, abdomen, pain while urinating, frequent need to urination, and risk factors that make you prone are family history of kidney disease, having an immune system disease such as lupus, and taking too many antibiotics.
Public health impact. Nephritis is the ninth most common cause of death in the U.S. with more than 90 million patients, 200,000 new cases per year, and 400,000 are with end-stage renal disease requiring dialysis or kidney transplantation. Most affected races are Black and Asian. Yearly death rates of ESRD patients are 20%. By 2030, deaths caused by chronic kidney diseases are expected to increase to 352,000.
The scientific paper we chose to evaluate was titled Renal Outcome and Risk Factors for End-Stage Renal Disease in Pediatric Rapidly Progressive Glomerulonephritis. This was a retrospective cohort study on children aged 15 years or younger with the diagnosis of rapidly progressive glomerulonephritis at the Department of Pediatrics in Bangkok, Thailand. Patients included in the study followed the following parameters of acute nephritis, abnormal urine sediment, with or without proteinuria, and the study had several limitations. Due to its retrospective design, there was a small number of patients, lack of renal biopsy from all children, and the relatively short median follow-up period, which was approximately 1 year. Given that renal pathology is not readily available in several developing countries, this suggests that long-term follow-up is needed in rapidly progressive glomerulonephritis patients, especially those requiring acute dialysis.
Most types of nephritis are caused by the body's immune system responding to an insult of some sort. This insult might be a drug or poison, an infection, or a change in the way your body responds to one of the substances in its tissue. Your body's antibodies often damage the kidneys as they respond to this insult. In some cases, the body's immune system attacks the filters, causing swelling and scarring. Some forms of nephritis have a strong family history, but often the cause of nephritis is unclear. Many types of nephritis require observation but no treatment, and rarely lead to long-term kidney damage. The treatment for nephritis depends on whether the disease is acute, chronic, or linked to other diseases such as lupus. Other people may need blood pressure medication, ACE inhibitors, angiotensin receptor blockers, a diuretic or a water pill, and dietary changes such as cutting back on protein, salt, and potassium.
In conclusion, nephritis refers to inflammation of the kidneys. The many different types of nephritis can be acute or chronic and range from mild, such as a UTI and kidney infection, to severe, such as complete kidney failure. Treatment usually involves monitoring the patient at checkups, keeping track of blood pressure, and making lifestyle changes. The outlook is favorable in acute cases because the nephritis usually goes away after treatment. However, in more chronic cases, there may not be a cure, but monitoring the inflammation usually keeps it in check. Haiku. Pain in the pelvis, bloody and cloudy urine, might be nephritis.